Hello again. Thank you for joining us today to help us launch The Pitch, a competition to fund knowledge champions in FPRH programs. My name is Lisa Moicambo. I'm with the Knowledge Success Project, the flagship knowledge management project for the USAID Office of Population and Reproductive Health, which is led by Johns Hopkins Center for Communication Programs. We are so excited to officially launch the pitch today and share with you some important details about the competition and answer any questions that you might have. Thank you for sharing in the chat what you're most excited about to learn. We see that we have colleagues joining us from all over the world, and that excites us immensely. And we will make sure to answer your questions. That's the purpose really of today's event. And we'll also, as many of you noted, are as well excited to see the innovations that come from this regional competition. So please feel free to continue using the chat box to pose any questions or comments that you may have. And we'll definitely leave some time at the end of the presentation to give people a chance to have their questions answered. So thanks again for joining us. If we can move on to the next slide, we just want to go through a few housekeeping items. We are providing live French interpretation during this webinar. If you'd like to listen in French, click on the interpretation icon at the bottom of your Zoom screen, then click on French. You'll then have the option to mute the original audio in English, so you don't have to hear that in the background if you choose. Because we are providing live interpretation, you may notice that we are speaking a little slowly and pausing before we transition to the next slides to give our wonderful interpreters a chance to catch up with us. I'd like to introduce today's presenters. As I mentioned, my name is Lisa Moicambo, and I'm a Senior Program Officer 2 at Johns Hopkins CCP. I'm one of the members of the team that's managing the pitch competition. I'd also like to introduce today my colleague, Rueda Salam, who's a Senior Program Officer at Johns Hopkins Center for Communication Programs, who is the team lead for our knowledge solutions and managed the co-creation efforts. So the plan for today's session is that Rueda will start us out with a brief overview about knowledge management, covering what it is and why it's important, and how the idea for the pitch competition came into being. Then I'll go into some guidelines around the pitch competition, and we'll leave time for Q&A. So now I'd like to pass it on to Rueda.
Great, thank you so much, Lisa. And thank you everybody for joining us today. We're really excited to be launching the competition today, and so glad that so many of you have been able to join us and learn more about the competition, and hopefully we'll be able to answer some of your questions. What I'd like to do is I'd like to just give a really brief overview about the Knowledge Success Project for those of you who may be a little less familiar with our project. So at Knowledge Success, our objective is to ensure that people working in family planning and reproductive health programs can find, share, and use the knowledge that they need to transform the lives of women and men all around the world. So I hope you all recognize yourself as one of our audiences, whether you're a program manager working in family planning, or a technical advisor, or a decision maker, or if you hold some other role in program implementation. So at Knowledge Success, we often get questions about what knowledge management is. So people often ask, well, what exactly is knowledge management? So at our project, we define knowledge management as a systematic process of both collecting knowledge and connecting people to that knowledge so that they can do their work effectively and efficiently. So why the focus on knowledge and knowledge management? I think we can all agree that knowledge is one of our most valuable assets to address global health challenges. What we know impacts how we take action, and how we manage knowledge can affect individuals, it can affect programs, and ultimately even health systems overall. In the family planning sector, knowledge management can improve coordination between individuals and programs and organizations, and it can enhance meaningful learning among health professionals. And the ultimate goal is to improve health outcomes. Many of us practice knowledge management every day without realizing it or without calling it by that name. So, for example, if you think about a healthcare provider and when they refer to the latest guidelines on how to treat a disease, they are using knowledge management. When a program manager rolls out a new mobile application to facilitate communication between community health workers, for example, and their supervisors, they are all using knowledge management. What do these approaches and activities have in common? Well, they all help global health practitioners share and apply valuable know-how in their work. And the results are a stronger health workforce, better health services, and ultimately longer and healthier lives. So I find this illustration a helpful way to break down on a very practical level what knowledge management looks and feels like. So this matrix shows how tools and techniques can fall on a continuum from collecting information to connecting people to that information. And on the other continuum, it shows that KM tools and techniques can push information to people and provide them with the tools so that they can pull the information themselves. So these two continuums create 4 quadrants of different knowledge management tools and techniques that can be used to help people get the information that they need to do their work effectively. On the top half of the matrix, you'll find those tools and techniques that involve more human interaction that connect people together. So simple things like meetings or conferences to more advanced and specialized KM techniques like peer assists. On the bottom half of the matrix, you'll find tools and techniques that are useful for sharing what's called codifiable knowledge, or knowledge that's easy to put down on paper. And so you'll find things here like publications and websites, which are useful for sharing information with large groups of people. Another reason why I like this illustration is that it's also a good reminder that knowledge management doesn't always have to be a technological solution like a database or a website. Knowledge management encompasses a wide range of activities that connect people together because we believe that at its core, knowledge management is about people. Knowledge is created, captured, and shared through human interaction. So we hope that that gives you a flavor of why we think knowledge management is important. But we also had an opportunity to have a virtual chat with Ellen Starbird, the Director of Office of Population and Reproductive Health at the U.S. Agency for International Development. And so we would like to show a short video clip of our chat with her. It's about 2 minutes long. And this is where we asked Ellen why she thinks knowledge management is important.
USAID is a knowledge-driven organization. We work on complex issues, often in complex and changing environments, and access to the right information at the right time is critical to our success. Good knowledge management ensures that we continuously learn, effectively engage, and always improve based on the latest evidence available. Knowledge and knowledge management are key components of my office, the Office of Population and Reproductive Health Results Framework. Knowledge generation, collation, Synthesis and sharing feed into our global leadership role and our role supporting field programs. And then in turn, what we learn in those domains creates the need for new knowledge and new ways of sharing that knowledge. So having that central to our framework and feeding in both directions to create a nice virtuous loop is really important. It's one of our most valuable assets in addressing global health challenges, and it impacts how we take action. Innovations in knowledge management, the way we access, share, and use information and knowledge, can improve coordination and enhance meaningful learning among health professionals. Current global challenges like COVID have really revealed how essential it is to share accurate knowledge and information quickly and in locally relevant ways. We can more effectively act on knowledge when it is openly, freely, and transparently shared. With reference to COVID, it's impacted the family planning community through disruptions in supply chains, the introduction of new guidelines and protocols for service providers, and anxiety among potential new and returning clients when visiting facilities. The family planning community, whether local, national, or global, is better able to respond quickly and effectively when it has accurate information in hand and systems and approaches that work for sharing that knowledge. We work today in more and more countries that are in crisis or recovering from crisis. We work in countries with very youthful populations and continued disparate access to knowledge. KM approaches that are tailored to these environments, that draw from the skills, experience, and trust that local entities can provide, are more likely to work and to be adopted. And this is perhaps particularly true in the area of family planning, which can be a sensitive topic politically and intergenerationally, and where myths and misperceptions abound.
Great. So I just wanted to point out a couple of key points that Ellen highlighted. One is that we really hope that this competition, the pitch, encourages innovation in the field of knowledge management, and innovations that come from countries themselves. The second is that COVID has really highlighted to us just how critical it is to have accurate and timely knowledge to make effective decisions. And that really applies to any health area, including family planning programs. Despite our best intentions, though, we know that family planning professionals often do not fully engage in the cycle of knowledge seeking, sharing, and use. What are some of the reasons for that? Last year, we had the opportunity to conduct behavioral science research, and we also convened co-creation workshops with family planning professionals. And we were able to gain a deeper understanding of the current knowledge management behaviors and needs of family planning professionals around the world. Just last week, we held a webinar to dive into these insights that we gained from the co-creation workshop specifically. So I would encourage folks to refer back to that recording for the details if you weren't able to attend. Today, I'll provide a quick summary of some of the key barriers and opportunities to effective KM. And we hope that this will provide useful background context as people generate and develop ideas to submit for the pitch. So some of the key barriers we identified were what's called choice overload and cognitive overload. So I'll start first with choice overload. This is when you are presented with too many choices, which can lead to undesired outcomes such as frustration and inaction. So family planning professionals reported that while greater access to the internet and technology has afforded better access to information, the sheer number of different information sources that exist can create feelings of being overwhelmed, particularly because there's no easy way to sift through all of the results. This, of course, is exacerbated by the fact that most health professionals are very busy and have little time to devote to robust information seeking processes. And what this can lead to is going back to the same sources of information, not looking for any new information, and sometimes even reinventing the wheel. A related barrier is that of cognitive overload. This is when too much information is presented in a way that's hard to understand, making it difficult for people to process and apply the information. And this is something that was really, really critical. It came up in all workshops as one of the key barriers to getting evidence and information into their programs. So family planning professionals reported that they needed actionable information that they can apply directly in their programs. But what they often found was that information was not contextualized or specific enough for their work. Specifically, they indicated that there is a lack of information about what works in family planning with details on the how of implementation, as well as information on what does not work in family planning and lessons from failures. They also noted that in addition to the global guidance and evidence, they wanted contextually relevant information that they could apply more directly in their specific areas. So, for example, experiences and lessons from countries that share similar demographics and norms and health systems. Family planning professionals also pointed to the issue that data is sometimes of poor quality. And even when it is of good quality, it is often presented in complex ways or formats that are not easy to understand. Finally, many family planning professionals pointed to the lack of resources in their native language as a major barrier to improving their family planning programs. And we saw this come up, of course, very much in our Francophone African countries with the limited availability of French resources. So it's not all bad news, though. There are some silver linings that I do want to point out. One set of opportunities that we identified fall into the category of organizational or social norms around the sharing of information. We found that there is a strong information sharing culture in the family planning field among organizations, and that many organizations over time have increased their awareness of the importance of knowledge management. And so they do focus on knowledge sharing and within their organizations and across organizations as well. They specifically called out the importance of collaborations and partnerships as a way to facilitate transparent and timely dialogue. So, for example, people from different organizations often come together in technical working groups or communities of practice, and they use that space to share more openly about what's working and what's not in their programs. These kinds of spaces offer that opportunity to share that important information in a timely way, since it doesn't have to go through formal publication processes or approval processes. In addition, the recent emphasis on democratizing information came up frequently in our co-creation workshops, which provides an opportunity to include new voices in the discussion and have it be less of a top-down approach. The other category of opportunities in knowledge management pertain to the incentives that drive people to share and use information. In general, family planning professionals are driven by an inherent desire to share their knowledge with peers and colleagues to improve the effectiveness of their field. And this also serves as a reciprocal action, so it fosters collaboration with and learning from other individuals. And recognition for that sharing also encourages more information sharing. So if we in our field make more use of recognizing and more intentional use of recognizing individuals and organizations for sharing important information with others, that could help to encourage that behavior even more. So with these barriers and opportunities in mind, what kinds of KM solutions can we start to envision, and can all of you start to envision to apply for the pitch? The ultimate goal in KM that we want to keep in mind is bridging that knowledge to action gap. So not only just accessing knowledge, but using that knowledge to improve our programs. So in our co-creation workshops, we generated hundreds of ideas of how we can get to this point. And we looked across the board across these ideas, and we were able to group them into 3 large categories. The first category consists of KM solutions that collect and document family planning information, that synthesizes and organizes that information so that it's easier to understand and use. The second category of solutions are those that connect people to the knowledge that they need and also to each other so that they can share and exchange information, they can ask questions, and it's also a way to enhance collaborations among professionals and organizations. And finally, knowledge management solutions can also focus on capacity strengthening or mentorship opportunities so that family planning professionals can learn from each other and grow their skill sets. What we heard loud and clear across our workshops is the importance of context and in encouraging innovations from people who understand that context and know the priorities and realities on the ground. And I want to make clear here that innovation does not necessarily have to be something brand new. It could be something critically important and missing within a certain context. It could mean adapting something that's been tried somewhere else to your context, or scaling a pilot project to another location or to a new audience. This is why we're launching this competition. The pitch is a way to find knowledge champions in sub-Saharan Africa and Asia with an innovative idea of how to get evidence and best practices into their programs, in their countries, and shared across the region. So these hopefully will be ideas that make sense for their given context. And the ultimate goal of these KM innovations is to ensure that programs are designed and implemented in the most effective and efficient way, that we learn both from what the community has done in the past and anticipate what's to come in the future, so that women and men can access and use voluntary family planning when they need it. So we hope this background information will help ignite some ideas for what kinds of KM interventions you can propose and submit for consideration to the pitch. And with that, I'll pass it back to Lisa to tell you more about the competition.
Thank you so much, Rowena, for that background. So let's dive in. The pitch aims to find, fund, and support organizations that are passionate about knowledge management for family planning and reproductive health and want to champion an innovative KM solution. In so doing, it will empower local stakeholders to share their own KM solutions for FPRH that address local priorities, as Rowena mentioned. The pitch will strengthen capacity in knowledge management and increase awareness among FPRH professionals about the importance of KM. The overall goal is to create a network of KM champions and innovators throughout sub-Saharan Africa and Asia in order to strengthen knowledge management and knowledge exchange and collaboration in support of FPRH programs. We reached out to Chandra-Mouli, a leading global health, family planning and RH and AYSRH, adolescent youth and sexual reproductive health expert and champion at the World Health Organization to see what excites him about the pitch competition. Please listen to his brief and passionate response.
Originally from India, and I lived in Zambia for 10 years and for a few months in Zimbabwe before joining WHO 25 years ago. And, I've often felt that the learned experiences from countries are given less attention and are paid less attention in development of guidelines, in informing action. And one of the things that COVID-19 has taught us is that the best responses did not come from the richest countries. They did not come from the countries which housed the oldest schools of public health and the most prestigious journals, or even from countries which spend an enormous amount of time, money, and effort in providing technical support to other countries. So for me, one of my life's work for the last 10 years has been documenting and evaluating initiatives which are outside the beaten path and often not looked at or re-looked at. So a competition like this, which pays attention to and respects learning from the ground, really excites me. And I think that really is the way to go. The best solutions are not going to be found in textbooks, and the old leaders in public health no longer have either the technical expertise or the moral authority anymore to provide guidance to the world. I mean, often you've found in documents published by many organizations about taking to research, research to action, and how important it is to get political buy-in.
So with that background and passion in mind, we're here to launch the pitch today, and we want to go through how it will work. So the first step is submitting an application of your KM innovation, and we'll walk through what that application form looks like shortly. Then semifinalists will be, the applications will be reviewed based on an established eligibility criteria and selection criteria, and 4 to 5 will be selected for Africa and 4 to 5 from Asia to then be invited to make a pitch in front of our esteemed panel of judges who represent the global family planning and reproductive health donor community. Those, before those pitch meetings are held with the judges, the semifinalists will receive guidance from Knowledge Success on how to make and prepare a successful pitch. During the actual pitch meetings, the semifinalists will have 5 minutes to make their pitch and also answer any questions that the judges may have. The judges will deliberate and make a final decision as to who the 2 winners will be per region. And then those winners will be announced through a YouTube premiere episode that will be hosted towards the end of March. They will receive a sub-award up to the amount of $50,000 US. And then they will be asked to implement over about a 5-month period in which they will receive coaching support for KM capacity strengthening from Knowledge Success. So why should you participate? The pitch really is an opportunity and a platform to introduce your knowledge management innovation, whether it be a new idea or an adaptation to an existing idea, to the broader FP community, regardless of whether or not you end up being selected to win. However, there will be 2 winners per region who will receive up to $50,000 US to implement their idea. They'll receive training and mentorship, as I mentioned, from Knowledge Success, and they'll share their experiences with the broader FPRH community through the Knowledge Success platform. So in terms of eligibility criteria, the applications must come from organizations in USAID family planning priority countries. As listed on the screen, those include Afghanistan, Bangladesh, Democratic Republic of Congo, Ethiopia, Ghana, India, Kenya, Liberia, Madagascar, Malawi, Mali, Mozambique, Nepal, Nigeria, Pakistan, Philippines, Rwanda, Senegal, South Sudan, Tanzania, Uganda, Yemen, and Zambia. And they must be, the applications must come from organizations. This could include organizations representing cross-country consortiums, such as the Population Health and Environment Consortium, or the East Central and Southern African Health Community, or even country-level technical working groups. In addition, the organizations must be legally registered and be able to provide proof of registration of their organization within the area of operation and country of location. Adhere to the Protecting Life and Global Health Assistance policy set forth by the US government, and have a registered bank account through which to receive funding. The preference will be given to local organizations, but we do not exclude international NGOs as long as they meet the eligibility criteria on this slide and the previous slide and are not already part of the Knowledge Success Partnership. So how to get started. As Rowena mentioned, if you haven't had the chance to attend the webinar last week on the co-creation workshop findings, please visit that, as well as the Knowledge Success website that has the report along with a summary, like highlight document, to start getting some ideas about what might be useful for your specific context. Meet with your colleagues to brainstorm ideas and discuss, and then complete the application form. And we're going to take you to that now. So the application form starts with a brief description about the pitch in English and in French, and then all fields of the application form must be completed to be considered. So the first few fields really are background information on your organization, as well as the contact information for the person submitting the application. Then we really start with the meat of the application, where we're asking for you to fill out what is the family planning challenge that you will address through your knowledge management solution. We give a character limit. It's simply a guide to help focus your responses. Based on that gap, knowledge need or knowledge gap, we ask you then to describe your KM innovation and how you plan to implement it. We provide probing questions for you to consider in that write-up, as you can see in the ABC probes. Then we would like you to think about what is the potential impact of your knowledge management solution as it relates to family planning programs and activities at the organizational, country, or regional level, and how that aligns to potential country or donor guidance in terms of your self-resilience roadmaps or journey to self-resilience and other country level commitments and policies. And then thinking in terms of sustainability, how could this innovation be integrated into existing work or leveraged by other stakeholders and partners? And then we ask you to provide a brief budget and template or timeline template You can download it via this link, and it provides really a simple high-level budget for us to get a sense of what it will take for that innovation to really be implemented over a late May to September timeline. And we ask you to kind of give us your vision for what are the main activities and milestones and how that budget came into being. These are all just suggested ways to complete that task. And once you do that, you can easily drag and drop it, if you will, into the application form itself through the attach file or the drop here. And then just to close the application, it's useful for us to know whether or not you've had experience engaging with USAID in the past, either as a prime or a subrecipient, as well as any other donors. So it's a pretty simple application. And if we go back to the slide deck, on the next slide, you'll see that really the application form helps us provides us with essentially criteria to also review applications. So we're really looking at, in addition to whether your USAID PRH priority country and the organizational requirements for eligibility, we're going to assess the innovation in the extent to which the knowledge management innovation meets an express need or gap in knowledge management for FPRH, the level of the organization's experience working in KM and or FPRH, has the innovation been done before? Does it add an innovative component to an existing idea? The potential impact of the KM innovation on FPRH programs or activities at the organization, country, or regional level, the extent to which the KM innovation can be integrated into existing work or leveraged by other partners, the extent to which the innovation would offer gender equality in terms of access to and use of the innovation, and the feasibility to implement within that 5-month implementation period and the funds requested. Excuse me. So once those 5 to 6 or 4 to 5 applications are invited or notified and invited to make a pitch to the judges panel, these are the ultimate judges that will decide upon the winner. And I'll briefly introduce you to them today. Miwita Buddhaharsana is a senior lecturer from the Department of Biostats and Population of the Faculty of Public Health of the University of Indonesia. For more than 30 years, she has been teaching population, gender, and women's health courses, as well as has work experience for over 15 years with 2 global NGOs, Pop Council and the Ford Foundation. Rodeo Diallo is a senior program officer at the Bill and Melinda Gates Foundation, managing the foundation's family planning portfolio in Nigeria. Before joining BMGF, Rodeo led a number of family planning initiatives of global NGOs in the Francophone region. As a result, Rodeo was named one of the most influential Francophone women in global health by Women in Global Health in 2018. Anthony Daly, Deputy Director, Family Health at the Bill and Melinda Gates Foundation's India Country Office. He leads the family health portfolio comprising maternal, newborn, and child health, nutrition, and family planning. Previously, he spent 20 years as a health advisor with DFID. Clive Matunga is Senior Technical Advisor in Population, Environment, and Development at the Office of Population and Reproductive Health, Bureau of Global Health, where he oversees and coordinates USAID's work that focuses on the linkages between population, environment, and development including the intersections and integration of family planning and the environment. Joanne Peters is Director of Social Innovation within Johnson & Johnson's Global Community Impact Team, with a focus on harnessing the power of technology to support and champion health workers at the front lines of care. She manages a portfolio of scaled mobile messaging programs. And Tara Sullivan, who leads CCP's Knowledge Management Program, is the Project Director for Knowledge Success and teaches in the Department of Health, Behavior, and Society at Johns Hopkins Bloomberg School of Public Health. She has worked for more than 20 years in international health with a focus on program evaluation, KM, quality of care, and FPRH. So before we move on to your questions, we prepared a few based on what we've been asked so far that I'd like to quickly go through. And hopefully these will address a number of the questions that we're seeing in the chat box. So first, do submissions have to be for a new innovation, or could they fund an innovation already being implemented? The answer is that the competition will not fund the continuation of an innovation, but will consider funding new components or adaptations of existing innovations, as well as expansions to different audiences or locations, or adaptations from one sector to another. Is there a limit on the number of submissions from an organization? There's no limit on the number of applications that are submitted per organization. However, only one submission per organization would ultimately be awarded. And that's why in kind of the next steps slide earlier, we discussed that you should meet with your colleagues to really brainstorm so that you come up with what you think your best ideas could be for submission. What languages will submissions be accepted in? Submissions will be accepted in English and in French, and the Africa pitch meeting in front of the judges will be available in English and in French, and then the ultimate YouTube premiere episode will also be available in English and in French. I just answered this a little early, sorry about that. But yes, so the competition will be broadcast for the Africa regional competition in English and in French, while the Asia regional competition will be broadcast only in English. And so these are key dates for your consideration. So February 4th is the deadline for the application to be submitted for your KM innovation and idea. February 10th is when the semifinalists will be notified and invited to make a pitch to the panel of judges. The actual pitch meetings to the judges, the Africa one will be March 2nd, and the one for the Asia semifinalists will be March 3rd. These will be closed meetings between the semifinalists and the judges. And then ultimately those will be recorded though into different types of video for an ultimate episode in which the winners are announced March 23rd. The Africa episode will premiere on YouTube, and then March 24th, the Asia winners will be announced. And then there's a little bit of time in between so that we can get the sub-awards in place with the winners' organizations. And then ultimately implementation should begin in late May through September. So really now it's the opportunity to go through the chat box and the key questions that have arrived so far, and to also remind you to visit the pitch website and to apply today. So I'm going to now start looking into the chat. Okay, so for the first few questions related to will the slides be available in the recording of this presentation? Yes, they will definitely be in the coming days. Anyone who's registered for this webinar, whether or not you attended today or not, you will get an email with all the materials and links. The next question, what countries in Southeast Asia are eligible? So the USAID Population Reproductive Health or Family Planning priority countries in Asia include Afghanistan, Bangladesh, India, Nepal, Pakistan, and Yemen. You can find the full list of USAID PRH priority countries in the slides and as well as on the pitch website. Will the competition be exclusive to Asia and sub-Saharan Africa? Yes, at this time, the pitch will be accepting only applications from sub-Saharan Africa and Asia organizations where USAID has priority family planning programs. There's a question as to, I see Burkina isn't on the list. I assume organizations in Burkina Faso can't participate. Priority will be given to USAID PRH priority countries, and unfortunately, Burkina Faso is not on USAID's priority country list. Can international organizations apply if they have a presence in one of the eligible countries? So as I mentioned, priority is going to be given to local organizations, but international organizations who meet the eligibility criteria and are legally registered in that country and are not part of the Knowledge Success Partnership already could apply. Sorry, just going through. I see a number of the questions hopefully we've already addressed in some of the Q&A that we provided. Can a group of organizations partner on a submission? And yes, we encourage organizations to partner together on a submission. However, if ultimately they are selected to win, one organization would be the one to receive the sub-award. So there will be kind of a primary one managing that engagement. Okay, and then there's the question again, you know, does the submission have to come from an organization? And yes, it does. If it's individuals can always apply on the behalf of an organization or a country consortium, such as like a local professional association, as long as the local professional association meets the eligibility criteria in which they're registered locally, they have a bank account, and they adhere to the global health, the PLGHA policy. Sorry, just getting through the list. Okay. So again, we're giving priority to USAID, family planning and reproductive health priority countries. So as a result, Indonesia won't be considered at this time. Let's see. That is the same for Sierra Leone. The list of USAID priority countries, maybe if you don't mind, Emily, going back to that slide for people, that might be helpful. Again, the actual link to the USAID website with the priority countries is provided on the pitch website. Thank you. A great question. You know, I'd like to know whether the innovations we will be presenting will depend on the reality or context of our own environment, or whether we need to take into account what has already been done internationally in other countries. The problem must be in my community, I think was a question. It's a French submission. You are correct. The innovation should really take into account the realities and context of your own environment. So we're suggesting you might want to take a look at what came out of the co-creation workshop, since they do represent a number of perspectives of the different regions. But we really do expect the submissions to be truly from the realities on the ground. There's a question, is there any need for a separate concept note for submission? And no need for a separate concept note. All the information that you need to include is in the application form. So as long as you are thorough in responding to all the fields, that's fine. Oh, there's a question, why didn't you think to include national organizations as well? And we apologize if there's confusion related to that. We are including national organizations. We're actually prioritizing local and national. Sorry about that. I think when I spoke to local organizations, I kind of meant it as local and national are the priority, but we will consider international as long as they meet the eligibility criteria. Sorry, just scrolling through a little bit more. Okay. Can you send questions related to the, can you send questions related to the submission as we are developing our application? And yes, if you have any additional questions about the application process, you can email info@knowledgesuccess.org, and our team will work to answer those questions. And that should also be highlighted on the pitch landing page. I'm gonna see if there's anything a bit different from what we've answered so far. So there's a question, Could we apply if it's an extension of an innovation? And I guess, as we mentioned, as long as it's not simply a continuation of the same activity, there's some kind of adaptation, scale up or adaptation, then that would be for consideration. Can organizations that haven't received funding from USAID apply? And yes. First, I think the question also includes a second question, like, is DRC a USAID family planning priority country? And yes, DRC is. And yes, organizations that haven't received family planning or haven't received funding from USAID can apply. The requirements are really that the organization be legally registered, adhere to the Protecting Life and Global Health Assistance Policy, and have a registered bank account through which to receive funds. We have just 2 minutes, so I'm looking to see. In the application round, closing February 4th, how much detail of a KM innovation idea is required? And on the pitch landing page, we provide a document on the application guidance that can be used to help you as you work through the application form itself. On the application itself under innovation, there's a number of probing questions to try to also assist you in explaining your innovation, and they relate to describe the KM innovation and how it will be implemented, what express need or gap in KM for family planning and reproductive health does this innovation fill? In what way is this KM solution innovative? Has it been done before? What does it add to an existing idea? How does the KM innovation address gender equality in terms of access to and use of the innovation, or addressing gender dynamics, if at all? And as we noted in the budget template, we are looking for kind of milestones, at least in terms of the planning related to implementation. I think I can also answer this question. What will be the contents of the coaching sessions for semifinalists? So all applications that are received will receive feedback as to how to strengthen them, or whether or not they meet the criteria, and whether or not they're invited to meet the judges panel. So we'll make sure to do that in terms of initial coaching. And then those who are invited as semifinalists, there will be 2 different coaching sessions that established to provide guidance on how to make a good pitch. And so right now, those are the plans, as well as Knowledge Success will be working with a video team to also help with the documentation of that pitch in case the live pitch meeting, there's any technical glitches in terms of connectivity. We'd have that pre-recorded pitch available to share. And then finally, what is the specific deliverable expected by the end of the implementation period? And that really will depend on the application itself and what the KM innovation is. I think that's everything we can cover at this time. We have a list. It looks like we didn't get to about 5 or 6 questions. So we can work to address those and send back. When we send the email with the recording and materials, we can send a link with also the Q&A. And at this time, organizations that are eligible must meet. Must adhere to the global. Must adhere to the Protecting Life and Global Health Assistance Policy. I see that coming up in the chat. So thank you all for your attendance and your excitement, and we're excited to learn from you and hear all about your ideas for KM innovations and solutions. And as I said, you'll hear from us in the coming days with this background information, but please feel free. A lot of these questions and answers can be found already on the pitch landing page and in the application guidance document, and apply online. We're looking forward to learning from you and seeing what is in store for the future of KM for family planning and reproductive health programs. Thank you.